السلام عليكم ورحمة الله وبركاته. Monitoring asymptomatic apical periodontitis in root-filled teeth results from a one-year follow-up prospective study done by a group from Sweden, published in IAJ in 2025. There is significant variation and disagreement in how asymptomatic root-filled teeth with apical periodontitis should be managed in daily clinical practice, while it has traditionally been assumed that these teeth should be treated, particularly from an academic and theoretical perspective. Many teeth with asymptomatic lesion left without treatment or systematic follow-up in general practice, reflecting a more conservative clinical practice approach. The natural course of apical periodontitis in root-filled teeth is largely unknown due to the scarcity of well-designed studies, although the infection and inflammation are likely to remain asymptomatic in most cases. So there is a need for evidence on the natural progression of apical periodontitis in root-filled teeth. So this study aimed to systematically and prospectively investigate the clinical and radiographical course of symptom-free root-filled teeth with signs of apical periodontitis over a one-year period. It's a prospective cohort study. They had 234 initially identified patients. Of them, 171 participated. After CBCT, 4 patients were excluded and 10 were lost to follow-up. This resulted in 157 patients with 157 asymptomatic root-filled teeth with apical periodontitis included for monitoring. Patients were scheduled for a one-year follow-up clinical examination, and evaluation included recording subjective symptoms, clinical findings like percussion, pain, tenderness, pocket depth, bleeding on probing, and estimating bone destruction size. Radiographic variables such as root resorption, unfilled root canals, fractures, instrument, overfilling and underfilling, and defective seal were also assessed. Bone destruction size was measured at the sum of 2 perpendicular diameters on intraoral radiographs with an initial inclusion criterion of equal or less than 10 millimeter. CBCT was performed at baseline, and patients with bone destruction extending beyond cortical boundaries were excluded. For the result, healing rates and clinical events among the 157 patients, 3 with 1.9% teeth developed symptomatic apical periodontitis and were treated, like 1 non-surgical retreatment, 1 surgical retreatment, and 1 were extracted. Another 1 tooth was extracted due to fracture. Also 8 patients reported mild pain or discomfort but did not seek care. The incidence of apical periodontitis related symptomatic conditions was 11 with 7%. Regarding lesion size changes in the size of periapical bone destruction were small, with a mean increase of 0.059 millimeter. The mean size increased from 7.25 millimeter to 7.31 millimeter, which was not statistically significant. Only 3 teeth showed an increase of more than or equal 4 millimeter, while 2 teeth showed a decrease of more than or equal 4 millimeter. Changes in other radiographic variables were generally few and not statistically significant, except for the estimation of the density of the seal, which was more often deemed poor at follow-up compared to baseline. So to conclude this study reinforced a previous finding that symptom-free root-filled teeth with apical periodontitis rarely lead to an exacerbation requiring treatment or a significant increase in bone destruction in the short term, with 8.3% of teeth developing symptoms during monitoring. The findings suggest that for asymptomatic cases, the necessity of immediate treatment is questionable, aligning with the practice of many dentists who monitor such cases without intervention. To identify potential risk factor, a longer follow-up period is indicated. Thank you.